Hey there, I'm Dr. Creger, and I'd love to share some helpful tips on how to present to your preceptor. I know it can feel a little intimidating, but don't worry, I've got you covered. In this video, I'll walk you through a clear and organized approach that will help you confidently present patient encounters and impress your preceptor with your enthusiasm. Let's dive in. Presenting to your preceptor means summarizing and communicating a patient's case in a clear, structured, and concise manner. It's an essential skill for nurse practitioner students, as it allows you to demonstrate your skills to gather feedback, implement clinical reasoning, and manage patient care in an organized way. One useful tool for organizing your presentation is the old cart mnemonic. This method helps ensure you gather and present important details about a patient's symptoms in a logical and thorough manner. Let's break it down. The chief complaint is the primary symptom or concern that brings the patient to your office. It's the foundation of your assessment. Gathering clear and concise information here. The best way to do this is by asking open-ended questions like, "What brings you in today? How can I help you today?" These questions encourage the patient to express their concerns in their own words and give you a strong starting point for your evaluation. Once you've identified the chief complaint, the next step is to gather more details. This is done through the history of present illness using the old cart mnemonic. The first part of the old cart mnemonic is onset. This helps you determine when the symptoms started and what was happening at the time. To gather this information, ask your patient, "When did your symptoms first begin?" Next, we look at where the symptom is. To determine where the patient is experiencing symptoms, ask, "Where are you hurting? Is that the only place? Or does the pain or discomfort spread anywhere else?" Understanding the exact onset and location helps in identifying possible causes and guiding further assessment. Next, ask the patient about the duration of the symptom to understand how long it has been present. You can ask, "How long have you been experiencing this symptom? Did it start suddenly or gradually? Has it been constant, or does it come and go?" Knowing the duration helps determine whether the issue is acute, chronic, or evolving. Now, you'll want to know more about the characteristics of the symptom. This helps you understand what the symptom feels like and any specific qualities it has. Start with an open question like, "Tell me more about your symptom." You can then prompt further by asking, "How would you describe the pain? Is it sharp, dull, burning, or throbbing? On a scale of 1 to 10, how severe is the pain? Do you notice any other sensations like tingling, numbness, or pressure?" The characteristics will help you differentiate between possible causes and refine your diagnosis. Next, you'll want to explore aggravating factors, what makes the symptoms worse or causes them to intensify. Ask your patient, "Are there certain activities, movements, or times of day that make the symptoms more intense? Have you noticed anything that exacerbates the pain or discomfort?" Identifying these factors helps you understand triggers and can impact your treatment plan. Once you know what makes it worse, it is helpful to know what they have tried to make it better. You can ask, "Have you tried anything to make the symptoms better? Have you used medication, rest, or other treatments to ease the symptoms?" Understanding what aggravates and relieves symptoms help you refine your diagnosis. Now ask the patient about any treatments tried. This helps you understand what has or hasn't worked. You can ask, "Have you taken any medications, either prescribed or over the counter? Have you tried home remedies, physical therapy, or other interventions? Did any of these treatments help or make things worse?" Finally, to fully understand the patient's experience, it's important to ask how the symptom has affected their daily life. This helps assess the severity of the issue and its impact on their well-being. You can ask, "How has this symptom affected your daily activities? Is it interfering with work, school, or hobbies? Has it impacted your ability to sleep, eat, or exercise? Are you avoiding any activities because of this symptom?" Understanding the impact on daily living helps prioritize treatment options and tailor a plan that improves the patient's quality of life. Now that we've gathered a detailed history, the next step is to collect pertinent history. This includes any relevant medical, surgical, family, or social history that could contribute to the patient's current condition. Here's what to ask. Medical history. Do you have any past medical conditions that might relate to the symptom? Surgical history. Have you had any surgeries that could be relevant? Family history. Does anyone in your family have similar symptoms or related medical conditions? Social history. Do you smoke, drink alcohol, or use any substances? What do you do for work? and could it be affecting your health? We're almost there. Now, it's important to review the patient's current medications and any recent tests or screenings they've had. Medications. What medications are you currently taking? Have you recently started, stopped, or changed any medications? Find out if any recent labs, imaging, or health screenings have been completed. Have you had any recent blood work, imaging, or diagnostic tests? And were there any abnormal results? Did you do any screening, such as lead screening or screening for autism? Reviewing medications and recent tests ensures that you have all the necessary information to make informed clinical decisions and to avoid repeating studies or tests. Let's put it together. 1. The problem statement. This includes both subjective findings that the patient reported and the objective findings, which are what you observed during the exam. 2. Primary diagnosis. Using clinical and deductive reasoning, determine the most likely diagnosis based on history, physical exam, and relevant tests. 3. Differential diagnoses. To ensure a comprehensive evaluation, consider at least 2 alternative diagnoses that share similar symptoms, but may have different causes or severity. For example, if a toddler presents with a sore throat, the primary diagnosis is strep pharyngitis, but the differential diagnosis can be viral pharyngitis or tonsillitis. Let's present our plan. Start by identifying the diagnostic tools or clinical guidelines you used. For example, Ottawa ankle rule was used to determine if imaging is needed for ankle injuries. Then jump into your plan. That include the following: medications prescribed based on guidelines, for example, penicillin for the treatment pharyngitis. Then list your proposed interventions, procedures, therapies, or lifestyle modifications. Finally, a good plan will capture a minimum of 2 teaching points for the patient and a definitive follow-up to resolution. But don't forget that preventive care is just as important as treatment. Address modifiable risk factors and discuss health maintenance strategies. For example, if a toddler with pharyngitis is exposed to passive smoke, educate parents on how tobacco exposure increases the risk of throat infections and offer them resources for tobacco cessation. As a new nurse practitioner, it can feel overwhelming to know where to start, but using an organized approach will not only ensure a thorough workup and clear decision-making, it will also help you manage your time efficiently and build confidence in your clinical skills. Keep learning, trust the process, and you've got this.